Hi, I'm Dave Delesk, CEO and co-founder of Embrace Prevention Care. Thanks for the opportunity to talk with you about Embrace Prevention Care and explain how our virtual clinic for healthy aging can improve the health of older adults in rural communities like yours.
We solve the problem of too many preventable hospitalizations, primarily among older adults. This problem is worse in rural areas, and the disparity between rural and urban health is increasing. Our cardiology advisor, Dr. Heather Varich, recently published an article in the Journal of the American Medical Association describing the growing gap in mortality rates between rural and urban communities. This table shows the 5 leading causes of hospitalization. Across these causes, rural areas have between 15 and 75% higher rates. Overall, a 29% higher rate of hospitalization in rural compared to other areas. For brevity's sake, we won't get into all the reasons for this disparity. However, one major cause is that the gaps in care that lead to preventable hospitalizations are greater in rural areas. Embrace's goal is to close these gaps and see the results in fewer hospital stays. For older adults with chronic conditions, hospitalization frequency is the best indicator of overall health. Here's why hospitalizations should be avoided. Older adults often experience decompensation from a hospital stay. Frequency of these events leads to a lower quality of life and less independence. Hospitalizations can cause a change in living situation, often requiring a move to a facility that is outside of the community. And finally, hospitalizations are the biggest cost component of older adult health care. Today, our healthcare system is not designed to effectively prevent hospitalizations. Providers have neither the time nor resources to focus on prevention. The Embrace team provides personal prevention care directly to older adults to keep them healthier and out of the hospital, while reducing the burdens complex patients place on clinical staff. We work with local primary care providers to help their patients implement personalized care plans. Our local nurse practitioners build trusting relationships with patients through frequent telehealth calls. They help patients take healthy actions to achieve what matters most to them. For most older adults, this includes maintaining their independence and being able to continue to live in their community. Here's how personal prevention care works. Our local nurse practitioner develops a detailed care plan with the provider and the patient, and then helps the patient follow it. She also coordinates with other local community resources to make sure both medical and non-medical needs are met. Our geriatric pharmacist helps patients take the right meds at the right times and can deliver them to their homes monthly. We regularly monitor the patient and watch their vitals when necessary to ensure they make progress. Expert guidance and reporting is provided from our prevention care platform. We adapt to the clinic's workflow and provide reports directly into your EHR. All these services are covered by Medicare, and the patient usually has no cost or only a small copay. Our partners see increased revenues since they supervise the delivery of these new services and achieve their quality goals. We have an experienced team delivering personal prevention care. In particular, Jenny Gudapati, our VP of Value-Based Health, who is also an associate professor at Boise State University, where she started one of the first value-based care programs in the country. She provided rural care in Idaho for 20 years and is familiar with the needs of rural communities and is passionate about improving rural care. Our growing team of expert advisors brings the latest evidence-based prevention care approaches directly to physicians and patients. An example is Dr. Heather Varich, mentioned earlier, who is a cardiologist at the Boston VA and conducts research to identify how to improve rural health care and treat heart failure. When we partner with you, we will start delivering care to patients within 91 days. We need to identify practices that want to work with us. We will hire a nurse practitioner in the region. Despite the shortage of nurses, we find that NPs want this job and have many applicants for the positions we advertise, even in rural areas. We provide training to the NP on our approach and systems. The NP will connect with community services. And on day 91, we start serving your patients. Here's what Embrace will deliver: healthier older adults who contribute to the community for a longer time, support for the clinical staff who are often overburdened, a stronger collaborative network with patients, clinicians, and social agencies, better outcomes with lower costs, the objective of value-based care. A model that scales quickly and easily to other rural communities, providers, and payers. We will help clinicians who are anxious to change the healthcare status quo and are willing to work creatively together to embrace prevention and address the current disparities. We look forward to working with you to make this happen. Stay healthy.